Good evening, doctors and friends. Today we are from SGD B6. We will explain about the article review about long-term prognosis of intracranial hemorrhage in children. This is our group team. And now I will explain about the introduction. So intracranial hemorrhage is a condition when bleeding occurs within intracranial vault, which includes brain parenchyma and surrounding meningeal spaces. When it occurs in children, intracranial hemorrhage often causes lifelong disabilities, such as developmental delay, cerebral palsy, and epilepsy, or even death. Intracranial hemorrhage accounts for almost 50% of all cases of stroke in pediatric cases. Intracranial hemorrhage may be difficult to diagnose because the presenting symptoms can be non-specific. So, as intracranial hemorrhage still accounts for high morbidity and mortality in children, research needs to be done to increase our knowledge about the disease. Searching for latest literature about the topic may help to deepen our knowledge, but we have to be critical in searching and choosing the literature. Critical appraisal must be done, as it allows us to use the evidence of the research reliably. Critical appraisals also help us to establish whether the evidence of research can be used to inform medical decision in a given context, and we can decide if the evidence of the research is valid or not. So there are problems. There is a case study given to us. Intracerebral hemorrhage, a form of stroke syndrome, results from the rupture of an intracerebral vessel. The parents of children 2 years old with hemorrhage stroke asked to the doctor about their quality of life after the disease. The doctor wants to find the best evidence to determine long-term prognosis of intracranial hemorrhage in children.
I'll talk about the formulation of clinical question. The type of question and PICO question is P for population of problem, is children with hemorrhagic stroke. I for intervention is intracranial hemorrhage. C, comparator or control, there is none. And O, outcome is long-term prognosis. From the PICO question, we are able to make the clinical question, which is, what is the long-term prognosis of intracranial hemorrhage in children with hemorrhagic stroke?
Yeah, for the literature research, we use several platforms on the internet, like Google Scholar, PubMed, and also ProQuest. And for we were searching for the suitable journals. We enter some keywords in the search column, and namely children, intracranial hemorrhage, and also prognosis. And for adjusting the journal publication time between 2010 and 2020.
Okay, now I'm going to mention about the journal that we use in this project. There are predictors of outcome in childhood intracerebral hemorrhage, a prospective consecutive course study by via PubMed. And also we have etiology, clinical characteristics and prognosis of spontaneous intracerebral hemorrhage in children, a prospective course study in China, search via Google Scholar. And then there are evaluation of intraventricular hemorrhage in pediatric intracerebral hemorrhage via PubMed.
Validity aspect of Journal A by title Predictors of Outcome in Childhood Intracerebral Hemorrhage, a prospective consecutive cohort study. Based on validity aspect question number 1, was a defined representative sample of patients assembled at a common, usually early point in the course of their disease. Based on this study, the samples are not representative to the target population nor recruited in the same phases. This is due to the samples obtained from the same hospital, which is a large tertiary care children's hospital stroke registry, and were not chosen randomly. All the patients were obtained from January 2006 until June 2008. Therefore, variation in hemorrhage and total brain volume may be found among the samples. Next. For validity aspect question number 2, Journal A, was a patient follow-up sufficiently long and complete? Patient follow-up in this study was carried out 3.5 months based on the median calculation. This means the follow-up was less longer compared to the previous study, which may lead to limitation on the long-term outcomes. However, the bias of the study was small, with one patient was lost to follow-up due to the patient was found dead to unknown causes. Next. As for validity aspect, question number 3, were objective outcome criteria applied in a blind fashion? The objective outcome of this study was to determine mortality and disability in children with intraparenchymal hemorrhage, and was assessed objectively using several standardized instruments. There are the pediatric stroke outcome measure and the King's outcome scale for childhood head injury. Next. For validity aspect, based on question number 4, if subgroups with different prognosis are identified, was there adjustment for important prognosis factor? Prognosis, based on this study, adjustment were performed by univariate analysis for various variables such as hemorrhage volume, altered mental status, gender, and Black race. And multivariate logistic regression analysis were also performed to adjust result from univariate analysis for age. Next. Based on validity question number 5, was there validation in an independent group test set of patients? Prognosis factor in this study were determined from several previous studies and was clearly stated in the introduction of this study. Which is prognosis of intracranial hemorrhage in pediatric cases were associated with hematologic abnormalities, infratentorial hemorrhage, and lower Glasgow Coma scale. In conclusion, the validity aspect of Journal A is quite valid, but not 100% valid due to the sample is not representative to the target population and the follow-up is not long enough. Therefore, 3 out of 5 validity aspects were fulfilled.
Okay, so now I'm going to continue for the next journal, which is Journal B, Etiology, Clinical Characteristic, and Prognosis of Spontaneous Intracerebral Hemorrhage in Children, a prospective cohort study in China. For validity aspect number 1, the sample of patients used in this study are from a single hospital in Chengdu, China. Other than that, it is not stated in this study that the samples were chosen randomly. For the recruitment phase, the patients were enrolled from January 2012 to June 2014, and a standardized form was used to collect the data and characteristics of the patients, including level of consciousness and stroke risk factors. Therefore, the samples were not really representative for the target population, and not all of the subjects were recruited in the same early phase of spontaneous ICH. For number 2, the patient follow-up in this study was done at 3 and 6 months after admission, long enough as the previous studies in the US and Europe that were stated in this study was also done at 3 and 6 months. There were 4 patients who were lost to follow-up and 1 patient who died from an unknown cause. Thus, the bias is moderate, which ranges from 5 until to 20%. Therefore, the follow-up in this study was long enough and moderately complete. Next. For validity aspect number 3, the outcome criteria stated in this study were both the mortality rate and disability rate of the patients at 3 and 6 months after admission. It is stated in the study that the enrollment of the patient was based on the diagnosis criteria and confirmed with neuroimaging examination. Other than that, statistical analyses were also done to identify independent variables as a predictor of outcomes. Therefore, the mortality rate and disability rate can be concluded as objective outcomes. For number 4, there were subgroups with different prognoses that are identified in this study, such as age, focal deficits, GCS on admission, localization, treatment, and complications. The adjustment for the subgroups were performed by doing statistical analysis using univariate and multivariate analysis, which is logistic regression to identify the outcome rate at 6 months. Therefore, the adjustment was done for the subgroups of prognosis factors. For Validity aspect number 5, in this study, the independent predictor subgroups for prognosis have not been confirmed before, neither from preliminary study or from other previous studies. Therefore, there was no validation. And overall, the results of this prognosis study of journal B are not 100% valid, as this journal is missing some of the validation aspects. The sample are not representative and not recruited in the same phase of spontaneous ICH, and there is no confirmation of independent predictor subgroups for prognosis. So 3 out of 5 validity aspects are fulfilled. Next is Journal C with the title Evaluation of Intraventricular Hemorrhage in Pediatric Intracerebral Hemorrhage. For validity aspect number 1, the samples included in the study are children with spontaneous intraparenchymal hemorrhage, which is a type of ICH, at 2 large tertiary care centers, and the sample size represents the largest prospective pediatric spontaneous ICH study to date at the time this study was published. Other than that, the samples were enrolled from 2007 to 2009, and it was stated that they were assessed using the IVH score based on the hemorrhage size. Therefore, the samples were representative enough to the study target population, but they are not recruited in the same phase. For number 2, in the study, it was stated that follow-up were done to assess condition of the patients using the King's Outcome Scale for childhood head injury. The time of each follow-up was not stated specifically. But there is a statement that states 4 children had a poor outcome at their last follow-up, and their last follow-up is a median of 10 months that ranges from 1 till 28 months. Other than that, there were no patients who were lost to follow-up, so this study has a small bias. Therefore, the patient follow-up in the study is sufficiently long and complete. Next. For validity aspect number 3, the outcome criteria that were applied in this study is by doing assessment to the patients by pediatric stroke neurologists using the King's Outcome Scale for childhood head injury. For the scoring system, 1 is for death, 2 for vegetative state, 3 for severe disability, 4 is for moderate disability, and 5 for good recovery. Therefore, it can be concluded that the outcome criteria is mortality and disability rates that were done objectively.
For validity aspect number 4, based on this study, adjustments were performed by multivariate models to adjust age more than 1 for several subgroups prognosis, such as presence of intraventricular hemorrhage, high intraventricular hemorrhage score, and high intraventricular hemorrhage volume. The results were not statistically significant. Next. As for validity aspect question number 5, there was no predictive power for prognostic factor used in this study. Next. In conclusion, the validity aspect of Journal C is also not 100% valid due to 2 out of 5 validity aspects were not fulfilled. The samples were not recruited in the same phases and no validation for prognostic factors.
I would like to discuss about the importance in Journal A. How likely are the outcome over time? The study did not show a graph or table regarding the survival rate at a certain time. The study stated that 1 patient died after surgical management, whereby in this study, from the median follow-up, which was 3.5 3.5 months in a span of 0.3 to 7.5 months, the survivors had neurological deficits, and which is by 71%, and 55% had clinically disabilities such as changes in mental status.
How precise are the prognosis estimated? This study has less precise because the result of the study have a wide 95% confidence interval value. Although the study has significant result on the disability variable, so that in this study has a greater uncertainty, although it is still precise enough to make a decision to become an outcome predictor. Next.
For journal B, the study stated that 66 out of 66 patients who completed the follow-up, there was a mortality, disability, and recurrence rate at 3 months and 6 months. At 3 months, the mortality rate was 3%, disability rate was 12.1%, and the recurrence of SICH was 1.5%. For 6 months, the mortality rate is 3%, the disability rate was 9.1%, and the recurrence rate is 3%.
And how precise are the prognosis estimated for journal B? There are 7 factors that have significant results. From the 7 factors, only one factor with a narrow confidence interval range. The factor is vocal deficit, with the value of odds ratio is 2.23, and the range of confidence interval is 1.68 until 2.97. Only those age 1 until 4 years had a significant value of 95% confidence interval range, and the OR is 0.05, and the confidence interval is 0.004 until 0.67. So that in this research, the size effect or effect size is less precise. Next.
Finally, for journal C, the outcome over time in this journal C, there is a table that states the outcome objectively. According to the study, 4 children had poor outcomes according to Koski, which is less than 4, at the last follow-up period with a median of 10 months, which is within the range of 1 to 28 months since enrollment. Meanwhile, 42 children had a Koski score more than 4.
And how precise are the prognostic estimated for journal C? Based on the research result, the results are not significant. The study stated that the intraventricular hemorrhage was not associated with poor outcome, but hydrocephalus saw a trend toward poor outcome, although no significant. However, the 95% confidence interval range for variable intraventricular hemorrhage was narrow, so that the effect size was precision. Next.
Hello, my name is Michael Christopher. So the applicability of the journal A, the samples are too much different because the sample are done in the Children's Hospital Philadelphia Research Institute, which take place in America. So USA is too far away from Indonesia, so there may be differences in races and ethnicity. And then, is the treatment feasible? In our opinion, the treatment is feasible and it's already common to use. So it is most likely to be able to be used in Indonesia already. And the potential benefits of the treatment outweighs the potential harms for the patients. So there are more benefits rather than risks. This can be found in the study that is stated that the risks are too small and cannot be detected. So it can be concluded that the negative effects are almost zero.
And for journal B, the sample of patients chosen in this study are from the hospital located in Chengdu, China. So there are racial and ethnic differences when compared to Indonesia. In conclusion, this research cannot be applied because this factor can affect the result of the study. And based on the characteristic of the treatment received by patient, it was divided into 2. There are surgery treatment and dehydration treatment. And feasible because the treatment written here are superficial. And based on the univariate analysis, it is stated that patients who receive surgery treatment and dehydration treatment may reduce the risk of mortality and disability, so that it provides a sufficient benefit for this patient. Next. And for journal C, This study was performed at the Johns Hopkins University School of Medicine, Stanford University School of Medicine, and the Children's Hospital of Philadelphia. And there are racial and ethnic differences when compared to Indonesia. So in conclusion, this research cannot be applied because this factor can affect the result of the study. And in this journal, the study does not write about the treatment. Next.
So for the summary, the article A, the prognosis based on article A, the survival had neurological deficient in 71% and 55% had clinically disability such as change in mental status. The validity aspect of this study is quite valid but not 100% valid. Based on the importance aspect, the article is still precise enough to make a decision to become an outcome predictor. Next. For the article B, the prognosis based on article B at 3 months of the mortality rate was 3%, the disability rate was 12.1%, and the recurrence of ICH was 1.5%. For the 6 month, for the mortality rate is 3%, the disability rate is 9.1%, and the recurrence rate is 3%. The validity aspect of this study is valid enough, but not 100% valid. Based on the importance aspect, the range of 95% CI values was very wide, indicating that the study had little knowledge of its effect and more information is needed. Next. Prognosis based on article C, 4 children had poor outcomes, has COSG less than 4 score, and 42 children had more than 4 COSI score. The validity aspect of this study is valid, but not 100% valid. Based on the importance aspect, the 95% CI range for variable intraventricular hemorrhage was narrow, so that the effect size was precision. So, based on the applicability aspect, the 3 subjects of the article was foreign subjects, so there are racial and ethical difference when compared to Indonesia. This factor can affect of the result study. So that's all for the presentation of B6. Thank you.